Thanks for joining us on National Focus. I'm Jarna Hector. Coming up, government's discussions with LIAT have been described as fruitful. We bring you a special report on the value of nurses in healthcare, and the Ministry of Urban Renewal embarks on a cleanup campaign of the city of Roseau. Stay with us for details of these and other stories after this.
A picture is worth 1,000 words. Got it? Taking care of us can be so easy.
Take good care of the children.
Thanks for staying with us. The Honorable Minister for Tourism, Senator Robert Tong, as well as Minister for Ports, Honorable Miriam Blanchard, met with the management of LIAT on behalf of the government. The meeting, which took place on Thursday, May 10th, gave government a chance to state clearly Dominica's position on the airline's quality of service to the country, as well as to hear directly from LIAT the current challenges facing the airline. GIS News spoke with the Honorable Minister for Tourism, Senator Robert Tong, on Thursday.
The Prime Minister did write to LIAT expressing his disappointment in the manner in which they handled a particular flight, and also in general the type of schedule that we had. Obviously, the Ministry of Tourism has been speaking about that, on the fact that we've been adversely impacted based on the number of flights, also the level of service that LIAT gives, whereby many persons had to overnight and couldn't come to Dominica immediately. So obviously that increased the cost of coming to Dominica, the time it took to come to Dominica. And we had a meeting with two executives from LIAT, Miss Julie Reefer Jules, the acting CEO and CFO, and Mr. Lloyd Caswell, the Chief Commercial Officer. The meeting was a very good meeting because it allowed us to understand what are the challenges of LIAT. And I think before you can put too much pressure on someone, you really need to understand what their challenges are.
The Honorable Minister revealed that the number of LIAT flights to and from the island and the timeliness of those flights were discussed.
We were concerned about the number of flights, but very important to the performance, the timeliness of those flights, because as we know, many flights are late coming into Dominica, and that too can impact on someone's, if it's a business trip, it affects it negatively, and also if it's a vacation, it also affects you, because time is money, and you're coming here to have a fun time. And if you're 2 hours late or 3 hours late, it means you can miss a flight, you're connecting flights, it just messes you up. So we definitely spoke to them about it, that LIAT needs to improve their customer service and their on-time performance, including the schedule. As you know, in 2015 we were impacted by Tropical Storm Erica, which happened in August. The airport opened within a short period of time, but obviously the flights were impacted, and LIAT itself had its issues in terms of the number of aircraft that they had. So they had quite a few, maybe I think about 13, 14, 15 aircraft. Right now they're down to 9 aircraft. So you can well imagine they themselves had to reorganize themselves and put a new schedule. Unfortunately, that schedule impacted us greatly. So we've been having discussions with them on a regular basis to get the schedule back to what will benefit our people in Dominica.
Coming out of that meeting, the Honorable Minister says a new flight schedule accessible on LIAT's website takes effect on June 1st. LIAT's additional aircraft is also anticipated to improve flight performance. The Discover Dominica Authority of the Ministry of Tourism has put in place a committee to further advance the issue of air access to Dominica.
We have an air access committee at the Discover Dominica Authority whose responsibility it is to discuss with all the different airlines to get as many flights in as possible. And we all know that last year we had the Norwegian flights coming from the US, and right now the Norwegian flights are coming from the US. There are also going to be flights from Europe into the US, so it makes it easier for persons to come to Guadeloupe and Martinique. And before last year, you only had the option of the ferry. And you also had LIAT, but LIAT would take you 8 hours to get from Dominica to Martinique. So now we've made arrangements with Air Antilles, and in December, when these flights start back, there will be flights going to the French islands, which will allow you to come to Dominica the same day and not have to overnight. So we're consistently working with many other airlines to try to improve on the air access coming into Dominica. We're also supporting a air access conference in June, where you'll have persons from all different areas, airports, aircraft manufacturers, charter companies, to come into Dominica to basically understand what our challenges are and discuss and come up with new ideas to make access into Dominica better.
In other news, International Nurses Day is celebrated on May 12th to commemorate the birthday of Florence Nightingale, a great nursing legend and founder of modern nursing. The Honorable Minister for Health, Dr. Kenneth Daru, addressed the nation on the occasion of International Nurses Day. GIS's Shakira Peer has this report.
Nurses play an instrumental role in the healthcare system of any country. They develop a plan of care, working collaboratively with physicians, therapists, the patient's family, and other team members, and focus on treating illness to improve quality of life. Hence the reason why Honorable Minister for Health, Dr. Kenneth Daru, believes nurses are integral to the healthcare system.
Reflections on this year's International Nurses Day theme, Nurses, a Force for Change, Improving Health System Resilience, brings into perspective the critical position of nurses in the healthcare system and the potential to impact health outcomes. Health system resilience has been defined as the capacity of health actors, institutions, and populations to prepare for and effectively respond to crisis, maintain core functions when the crisis hits, and be informed by lessons learned during the crisis and reorganize if conditions so require it.
The minister says government has placed significance on the primary healthcare systems in Dominica by making finances available for the renovation and expansion of the Reginald Fitzroy Armour Hospital in Portsmouth and several other health centers around the island. The continued diligence of nurses in the primary healthcare system, the minister says, is important for quality services.
Nurses are by far the largest single group of health professionals in the Ministry of Health, and it is well recognized that their role hinges on all aspects of the health system. Nurses are key players, change agents, and crisis managers in the implementation of our strategies and policies to achieve the mandate of the Ministry of Health in critical areas such as primary health care, the Port of Spain Declaration on Chronic Non-Communicable Diseases, the Millennium Development Goals, the Sustainable Development Goals, universal access to health, and universal health coverage.
On January 17, 2014, Dominica reported its first case of chikungunya. Between December 15, 2013 and July 12, 2014, a total of 3,559 chikungunya cases was reported in Dominica, of which 141 were confirmed by laboratory testing. The remaining 3,418 patients were considered infected, indicating an overall attack rate of 5% on the population. Currently, the Ministry of Health has taken steps to mitigate the damage of the current threat, the Zika virus. In the midst of all this, nurses have been a driving force.
As I reflect on the response of the Ministry of Health and Environment subsequent to the recent disease challenges, to include the threat of the Ebola pandemic, the chikungunya epidemic, and now the Zika disease, as well as the response to the disaster posed by Tropical Storm Erika, the contribution of the nurses to improving the healthcare system resilience have been overwhelming.
As of today, 100% of nurse educators at the Dominica State College and 78% of nursing supervisors are trained at graduate and undergraduate levels. This has facilitated a higher level of basic training in nursing to meet the demands of the healthcare environment. Generic and accelerated bachelor's degree programs in nursing and the Bachelor of Science in Midwifery are now available at the Dominica State College. Human resource is key to any organization, country included. Honorable Daru says this is why government has facilitated the further training of nurses.
The areas of training include advanced practice nursing, intensive care, public health, mental health, maternal and child health, counseling, and nursing administration at tertiary level institutions in the region and internationally, to include China, through our diplomatic relations with the Chinese government. There are also provisions for short-term training in oncology and dialysis in the U.S. on an ongoing basis, as well as disaster management and mass casualty management locally.
Minister Daru assures that the Ministry of Health will continue to work with healthcare professionals, especially nurses, to elevate the nursing service.
Today, I wish to affirm the continued commitment of the Ministry of Health in its efforts to develop the nursing service. I also wish to assure you that on completion of one new hospital with the anticipated state-of-the-art facilities, technology and equipment, working conditions will be significantly improved. However, the resilience of all health providers, and particularly the nurses, will be critical in supporting this major change initiative. I therefore take this opportunity to implore the continued cooperation and support of our nurses as a force for change in their various roles at all levels, as they contribute to improving the resilience of the health system during the anticipated challenges throughout the construction of the new national hospital. We appreciate the work of our nurses in keeping the population healthy through preventive, curative, and rehabilitative programs, and recognize the invaluable contributions being made to continually make improvements in nursing and healthcare.
Since 2015, at least 15 new staff nurses have been stationed at the Princess Margaret Hospital. This represents 100% appointment for all departmental nurses. The Dominica Nurses Association was formed 58 years ago. For GIS News, I am Shakira Pale.
Thank you, Shakira, for that report. In more news, Acting Director of the Forestry, Wildlife and Parks Division, Minchinton Burton, is calling on hunters and nationals alike to respect the open and closed policy of the hunting season. He was speaking at a hunters workshop on Wednesday.
The issue of illegal and hunting and legal hunting, as you well aware, the Forestry Division and Wildlife and Parks Division have over the years been very much involved in ensuring the sustainable use of our natural resources. And as part of that, hunting is a very, very important part of that. And that's why on the Forestry and Wildlife Act, we have instituted an open and closed season for hunting. Of course, one of the key requirements, one of the key reasons for that, of course, is to ensure that the populations, that we can actually sustain the population for future generations. In fact, in Dominica, if you're aware, in many other countries, they do not, the abundance of wildlife that we now enjoy. And many of other countries, especially in our region, some of our neighbors do not have that abundance of wildlife species.
He stated that without proper management, Dominica's wildlife will suffer.
The work that we've done in ensuring that we manage the wildlife resources, that has actually ensured that we do have still have wildlife species that you are able to enjoy during the hunting season. So we have an open season, which normally these days is about a 3-month period, normally between October and the end of December. And we normally do that to coincide with our independence anniversary celebrations, which is the time, of course, where we have a lot of expressions of our culture. And we allow people, of course, to be able to come in and partake and hunt and partake in our cuisine. And then for most of the year, we actually close that season to give the populations an opportunity to be able to recover. Were it not for that sort of management system or regime, I'm sure that many of the species that we're seeing here now would have probably been extinct or near extinction.
The director encourages hunters to submit relevant data and help the division update its database.
You as hunters are obliged to maintain a healthy and biologically diverse wildlife population to protect their habitat. And it's very, very important that we can actually get from you some of the assist us in actually collating data, because a lot of you are out there. In fact, we get a lot of important information from a number of you over a period of time as far as the hunting population. Some of you actually tell us when areas that you find that you see less species, let's say, of manikou, agoutis, etc. And you can actually observe the health of the animals, the population changes, etc. So you can also assist us in actually the amount of catch in areas that, certain parts of the island where the abundance of the species, etc. So it's very, very important that we can actually be able to improve on our data collection. And your presence here today will also assist us in being able to improve on that aspect of gathering data as far as hunting is concerned.
You're watching National Focus. More when we return.
I had a bleeding disorder that I did not know about, and they had to be transfusing me continuously. I got 56 units.
Being there at the blood bank, I was like, yo, I'm actually saving someone's life.
You never know when you can go.
Give blood. I have done it, and believe it or not, it don't hurt.
I won't be scared. I'll give. You know you're gonna give blood. I'll make sure she does.
Sit down at the blood bank in a comfortable environment for 45 minutes.
Helping people.
You are stimulating your body to make brand new cells.
You get free cookies, you get juice.
Glad to know your blood group. Feels good.
I felt as a better person.
It's a good thing to be alive, and I can thank God that I'm there and I'm enjoying life.
Welcome back. The Ministry of Tourism and Urban Renewal, working closely with the Roseau City Council, has embarked on a cleanup campaign of the city of Roseau. GIS News spoke with the Honorable Minister for Tourism and Urban Renewal, Senator Robert Tong, in an exclusive interview on Thursday.
First and foremost, the city has to remain clean for our residents. It has to remain clean so that there's less rodents moving around to reduce illnesses. And at the same time, you want your gutters to smell clean as opposed to smelling dirty. So just imagine someone coming to visit who's not used to that. That's going to be a major turn off to them. So we got involved because we are cognizant that it impacts on tourism. Even when you looked at the BREA report, one of the low scores we got was in terms of cleanliness. So what we did was to look at the entire report and ensure that we have a suite of objectives that deals with all of the various issues to ensure that we can deal with them in a proper manner. So we did a full sweep of Roseau, but what's happening now from 5 o'clock in the morning to 10 o'clock in the day, you have about a team of 12 guys going for Roseau, making sure they clean the gutters and make it look more presentable. So if you look right now, you will see the gutters are cleaner than they used to be before.
He notes that the issue of litter must be concerning to all.
The fundamental issue that we have is that as soon as we clean, people are still throwing litter in the drains indiscriminately. They're throwing bottles in the drains, even when there's the green bins. If you go to the green bins, most of them, I would say 90% of them are empty. Not very empty, but not full as compared to one or two that are extremely filled because based on the location. So we really implore on the people of Dominica to have a bit more pride and ensure that you do the same practices that you do when you're not in Dominica. When you're in another country, you don't throw the garbage because you're scared that you're going to get fined. And likewise, you need to do the same here.
He's calling on nationals to play their part.
I am Dominican, I don't litter. That's one of the campaigns we're planning to do very soon to bring back the pride that, hey, I'm a Dominican and I do not litter. Dominica is a nature island of the country, but it's not as clean as it should be. So we're starting that campaign. We're hoping that if it works in Roseau, we can replicate that campaign in all the other communities. So again, we depend on you. As I said, garbage has no feet, it has no hands. It's not able to move unless the wind blows it or the water in the gutter blows it. So we have to stop that practice of this indiscriminately throwing garbage all over the place, and Dominica will be a much better and cleaner place.
In more nursing news, Principal Nursing Officer in the Ministry of Health, Cesarina Farrell, is pleased that the Ministry and the Dominica Nurses Association can work together to improve nursing standards in Dominica. She was speaking at the Educational Symposium on Wednesday, one of the activities planned in observance of Nursing Week this week. Farrell says the ministry is focusing on making healthcare services run smoother.
We have an in-service education program in the nursing service. So on a monthly basis, there's a supervisor who is assigned to continue education or staff development, and on a monthly basis there are planned programs for nurses. In addition to that, there's the mentorship coaching program where a senior nurse is assigned to in-service education to complement the mentoring coaching program. So those are two in-service education programs going on simultaneously. So all of that is in an effort to encourage nurses to give the quality of care and to instruct the nurses as to what's in terms of their code of conduct, quality of care, professionalism, and a host of other areas.
She calls on nurses to give their best customer service and maintain professionalism. And an exciting lineup of events is carded for this year's Fête Isidore in Granby. Chairman of the Granby Village Council, Edward Regist, invites Dominicans to another eventful weekend from Friday, May 13th. Regist says the council has collaborated with the government of Dominica and several sponsors to host the weekend of events. The Feast of St. Isidore is the patron saint of laborers.
We, of course, have organized from Friday night. That's going to be a village night with a number of DJs and a number of activities at the various hotspots in Granby. Then on Saturday night, we have International Soccer Night at Matutus Park. It's a fundraising event for the council. We have coming from Barbados, Kiomal Nurse and Edwin Yearwood from Crossfire. And we also have Onion out of Burning Flames from Antigua. And they will be featured artists at that International Soccer Night. We'll also have from Granby the Midnight Groovers and Michael Henderson, and they will all be backed up by the First Serenade Band and supported by GX Songs.
Regist is calling on the public to support the events which are planned to raise funds for the council.
We've had to, transform that activity to a big people fete, and so the Swinging Stars Band will be with us along with other artists and guest performers on Sunday night again at Matutus Park. On Monday we'll have the church service that a number of people always come to. It's a Creole Mass, it's a cultural celebration of the Feast of St. Isidore, and we invite the public to come to that. And after that, in the afternoon, there is a rally by the Crime Stoppers organization, and then later on there's going to be a band splash, a band extravaganza.
The Band Splash is a free event, but patrons are encouraged to bring contributions to community projects in Granby. And that's the English news. McPherson St. Luce is next with Creole highlights.
Allô tout le monde, bienvenue à cette nouvelle en créole. Non moins, c'est McPherson St. Louis. Premièrement, le gouvernement Dominique a fait l'argent available pour le projet infrastructure en Granby. Mon parlement, Honorable Justin Charles, fait présentation $34,000 pour chemin Saint-An en Granby bon matin là.
Bon matin là, McPherson nous allons en chemin nous just bâti avec chemin ça là nous savons nous taper là en haut gouvernement bah nous l'argent pour faire chemin là plus qu'ils ont $100,000 avec ça nous fait nous joindre n'a pas un travail ça là so ça moi fait qu'on parle avec ministre finance et il d'accord pour ben nous l'argent là pour faire joindre mais pendant temps contracteur a fait travail là il même hot poche il fait joindre so ça nous qu'a fait aujourd'hui là nous qu'a village council because pour mieux cette travail là nous fait avec village council nous travaillons ensemble avec village council so village council était responsable pour garder comme ça contracteur qu'a fait so nous qu'a bar village council l'argent là because village council ouais travail là nous qu'a bailler l'argent là à $43,000 pour yo ça payer contracteur so yo ni pour faire arrangement pour yo faire l'argent ça là bas contracteur ça l'argent ça là mais travail ça là déjà fait.
En même temps, Honorable Charles aussi présenté $100,000 pour réhabilitation chemin Balapap.
L'autre chèque là nous avons c'est $100,000 nous allons voir l'autre contracteur ça c'est monsieur John Baptiste qui allait travailler dans nous le chemin qui a rentré en Balapak. Donc Balapak qu'on nous savent la pani pièce chemin là nous pani surface en l'air c'est chemin terre qui là avec ça depuis nous vendre là c'est comme ça chemin là et avec ça nous c'est autant moun qui a commencé faire casio on dit dans là et nous ni deux trois moun qui reste là et yo même qui complain chemin là mauvais la pluie tomber qui a laver chemin là avec difficile pour même voir ti mener yo en dedans so ça nous qu'a fait nous qu'a bail $100,000 avec contracteur qui commence à faire travail là comme on dit travail là même nous besoin plus que $600,000 pour nous faire toutes ces chemins là en Balapak because ni comment différents morceaux chemin so nous besoin ça mais ça c'est commencement travail là avec comme on dit qu'on parle plan on commence à continuer travail avec ministre finance pour nous ça ouais quitte nous que ça tape l'autre morceau pour nous faire so nous que fait chaque temps nous que fait morceau juste nous finir chemin.
En la nouvelle, plusieurs d'autres activités en parmi recognition award qu'a formé par activité pour semaine NOS l'année 2016. NOS Deborah Philippe, c'est président association NOS Dominique.
Nous avons NOS Appreciation Day, la toute NOS qui est venue avec chef à Ministry of Health, Principal Nursing Officer, qui a apprécié nos certificats, avec quelque chose bon pour faire, ouais, ils apprécié nos. Avec samedi, McPherson, nous allons aller en mer, nous allons regarder Will samedi. So nous allons aller Encourage Hotel, et nous allons aller en mer regarder Will. C'est ça qui est l'activité pour semaine là.
Messieurs, mesdames, ça c'est tout pour nouvelles en créole pour à présent. Non, moi, c'est McPherson St. Luce. Au revoir.
Research shows that balancing adequate rest and study sessions help retain information. An interesting suggestion is to double your study time by breaking up your study periods with sleep. For example, study and practice for 3 hours and sleep for 3 hours, followed by 3 more hours of work. That in effect tricks your body into thinking that you have studied for 2 consecutive days. That's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website news.gov.dm. Like our Facebook page, facebook.com/GIS News Dominica, and follow our Twitter at GIS Dominica. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. Live streaming is now available also on our YouTube channel 24 hours a day. From all of us here on the GIS News production team, I'm Jarna Hector. Thank you for watching and join us again next time on National Focus.